How do we estimate the risk of disease? Well, disease, of course, is something that is destructive in the body. It's a process, it's a dysfunction of some system inside the body. And diseases occur at varying rates, really dependent on what we would call risk factors. Obviously, there are many, many thousands of diseases that are possible to happen, and each one of these carries with it a set of risk factors. And within these risk factors, we have what we would call modifiable and non modifiable risk factors. A modifiable risk factor is something that the person can change, such as, for example, exercise. Increasing the amount of exercise one does is likely to reduce the risk of several different diseases. Smoking, for example, the act of smoking will increase the risk of several diseases. So people can modify their risk factors. So we can look at that. We can also look at these non-modifiable risk factors, which often are things like genetic factors, a family history of cancer, for example, or a certain gene type that a person might carry. And so we're going to estimate the risk of disease. We have to look at the whole host of modifiable and non-modifiable risk factors. And right now we have a good understanding of many of those, but I think there's many more we don't quite understand, which are very detailed genetic predispositions. And so this is an area that we certainly can work on using artificial intelligence, natural language processing, and blockchain to better be able to estimate the risk of disease.